Welcome to this presentation of the SALA healthcare program. As you will see, the program is affordable, accessible, and effective. The program is really an effort to simplify the complex healthcare system that we have today. It offers a great choice of affordable healthcare solutions. The program meets ACA requirements for preventive care. As you can see on the bottom, the average monthly savings members can realize is about 50% when compared to traditional insurance. This can vary not only by what state you live in, but where within that state you live. Lastly, we surveyed participants in the program, and you can see on the last bullet that 91% reported being either very or extremely satisfied. The program is an alternative approach to traditional health insurance. In bringing the program together, we have two main partners. The first is eBenefits administrators, and they offer two plans to choose from that focus on preventive care. The second is Sedera, and they provide medical cost sharing for the larger unforeseen medical expenses. You can think of our healthcare in three components. There are large costs such as surgery or hospitalization, which we refer to as needs. Small to medium costs such as a cold, sinus infection, or the flu. And preventive care, including childhood immunizations, colonoscopies, and mammograms, and everything in between. The large costs or needs are addressed through your Sedera membership. Sedera is medical cost sharing, and for those of you who may not be familiar, medical cost sharing dates back to the 1980s and has had a foothold with religious organizations. Sedera's parent company is the CARES Group, and they are a company many of the religious groups use to negotiate their larger bills. When our healthcare costs started to increase at a high rate, the CARES Group formed Sedera. Sedera is built upon the same best practices as the religious groups, but they are not a religious organization or a healthcare sharing ministry. Let's start where most of us are right now. More than half of Americans under the age of 65 get their healthcare solution through their employer. That's roughly 158 million people. Total premiums for these people have increased by 55% since 2010, while deductibles have gone up 111%, and all the while wages have increased by only 27%. There have been a number of non-insurance healthcare innovators over the past 25 plus years, including on-demand clinics, virtual services, medical cost sharing, and more. As we noted, Sedera is not insurance. They have built a company that empowers individuals by providing direct access to care. First, let's talk about what makes medical cost sharing unique. With Sedera, every member is a cash pay patient, which means they pay the healthcare providers of their choice directly for their services. There's no middleman marking things up or telling members which doctor they have to see or what services they can receive. Sedera is a people over numbers company. Said another way, Sedera cares about their members. Sedera is also passionate about helping members become savvy healthcare consumers. Philosophically, they believe there is power in taking control of one's own healthcare, so they stay out of the doctor's office and let the patient and doctor decide what type of care is necessary. However, a big part of what they're doing as a community is teaching members how to shop for excellent, affordable health services. Sometimes, when searching for a provider or shopping for a prescription, it can be hard to know where to start. That's where Sedera's member services team comes in. Sedera members also enjoy a freedom from networks. Sedera does not dictate where members can and cannot seek treatment. Because Sedera members are cash pay patients, there are no cards and no networks. Sedera members honor a commitment to a healthy lifestyle. Members agree and believe the first way to reduce healthcare costs is to take care of themselves. Finally, everything is handled on a per-need or incident basis at Sedera, as opposed to an annual household amount. With Sedera, members receive reimbursement for medical expenses when the cost for a need exceeds the member's initial unshareable amount. The initial unshareable amount, or IUA, is the total amount the member pays before sharing begins for a need. When members join Sedera, they set their own IUA. and that changes how much they can contribute to the community each month. You can see the different IUA options here. Let's use a quick example. I'm a Sedera member, and if I fall and break my leg today, that's a need. There are likely going to be a number of bills related to that, right? Perhaps an ambulance ride, doctor visits, prescriptions, x-rays, maybe even surgery or physical therapy. All of these bills are associated with the same single need. As a member, I'm responsible for my IUA. Let's say I've selected a $1,000 IUA. Once I've paid my IUA, I'm looking to the community to share the costs exceeding $1,000. So how does that work? If I walk in to the ER, I'm not presenting a Sedera card. Rather, I'm presenting myself as a cash pay patient. I'm going to pay as little as possible up front, no more than my IUA, and request to be billed directly for all the remaining bills. I collect my bills and send them to Sedera using the member portal. Sedera facilitates the sharing and sends a check or ACH to me. Then I, the member, pay the providers. Of course, this is just one example, and not every need, hopefully, would be at the ER. In many cases, a need can drag out for multiple visits rather than one expensive one. In these cases, I may be paying out of pocket at the time of service and keeping track of all the receipts and bills and sending them to Sedera for sharing. The good news is, the Sedera member has the member services team to support them at Sedera with any and all questions. Sedera members are never alone. Finally, Sedera limits the costs that members are responsible for each year. Members in households that experience multiple needs within their 12-month membership year are required to pay the first 3 IUAs at the selected amount. If there is a 4th need during the same membership year, no IUA would apply. While this is very unlikely, it is set up in this way to help reduce costs to our members in the event that they're having a really tough year. Now let's talk about how sharing works. Let's take a look at a real-life example. This family is on a traditional insurance plan with co-pays and a deductible. The family's 1-year-old child gets a really bad ear infection. They take the child to the doctor several times, going through a series of antibiotics and booster injections until finally they're referred to a specialist who recommends surgery, and they put tubes into the child's ears. As you can see on the left side, all of these out-of-pocket costs added up over time to just over $2,500. Unfortunately, the story gets worse. They had to go back to the doctor several months later, which, unfortunately for them, bled into the following year. As we all know with insurance, the deductible is reset at the calendar year. They found that the tubes had fallen out and they needed to replace them. A few more visits, a surgery, and another $2,500 later, and this has become a $5,000 ear infection. So let's quickly look at the same scenario if this family were Sedera members when all this happened. If they're paying as cash pay patients for the care, so no copays, you can see what their costs might look like on the right side. Once they meet their IUA, in this case $500, the community shares all the bills after that point. With Sedera, we would only consider this to be a new need if the member had gone a year without symptoms or treatment. So when the child needed the tubes replaced months later, it would have been shared with the community at no additional cost to the member, because the expenses are considered a part of the same original need. There are sharing restrictions in place for medical conditions that existed prior to membership, so let's talk about what qualifies as a pre-existing condition when you join Sedera. If a new member has had symptoms or treatment in the 36 months prior to joining, it's considered pre-existing. These conditions will be disclosed during enrollment. Then, in the first year of membership, there is no sharing costs related to those conditions. In year 2, there's a $25,000 limit. In year 3, it goes to a $50,000 limit. And then after year 3, these needs are fully shareable with the Sedera community. So let's look at a real-world example with one of our members with rheumatoid arthritis. Through the eBenefits side of the program, which we'll discuss in a moment, visits to the rheumatologist are covered, as are prescriptions for maintenance medications. However, should a need arise as a result of their RA, say a surgery is needed, the pre-existing restrictions would be followed. What we generally tell folks is that the program is a great option for probably 80% or more to consider, including many with pre-existing conditions, but it may not be the right fit for everyone. If you have specific questions, please let us know and we will get you an answer. The last thing we want is for someone to enroll and not understand the restrictions. So let's discuss the additional resources your Sedera membership provides. We look at medications in two categories, curative and maintenance. Curative medications are prescribed temporarily. Think of things like antibiotics, pain meds, or chemotherapy in the case of cancer. Members can submit bills for these medications as part of a larger need that they're curing, and those bills could be shared with the community after the IUA is met. Maintenance medications, however, are medications that a person takes on an ongoing basis. Things like blood pressure medication or cholesterol medication. For the first 120 days following a new diagnosis, these meds could be shareable as part of the need. After that time, they become an expense that is paid by the member and they are not eligible for sharing. Members have a few different ways to have maintenance prescriptions paid for. The first is the eBenefits Summit Plan that offers prescription drug coverage. This is how most participants in the SALA program have their maintenance medicines filled. You can also turn to third-party providers such as GoodRx or the SALA HP National Drug Card. The RX Marketplace is also included with your Sedera membership. For those who choose the eBenefits Summit Plan, Citizens RX is available, and I will discuss that in detail when we review the eBenefits options. One of the things that's most exciting about joining Sedera is all the tools included in the membership that enhance the member experience. They provide ways to not only contain costs, but also ensure that members have the information they need to make smart decisions and get the best and most appropriate care possible. Sedera includes the unlimited version of Teladoc in their membership. These are board-certified doctors who can put together a treatment plan and prescribe medications over the phone without the member having to leave the comfort of their home. The calls or visits are free for general consultations, and members can use the service as much as they need. It's been found that second opinions are often necessary in a new diagnosis or when surgery is recommended by a specialist. However, it's not always convenient to get one. In some cases, you have to wait weeks to get in, and there is added cost which can prevent people from getting a second opinion when they need one. SecondMD is an expert second opinion service made up of a network of doctors leading in their particular areas or fields of medicine. SecondMD makes it super convenient to get a second opinion. You make one call to speak to a nurse who gathers all the information and collects the necessary medical records on your behalf, and then schedules a teleconference with a specialist who will consult with the member. There is no cost to our members for using SecondMD. Important to note, Sedera requires a SecondMD consultation for non-emergency procedures or surgeries. In these scenarios, Sedera will reduce the member's IUA by $250 for that particular need. If, for whatever reason, the member refuses to use SecondMD, Sedera will only share half the cost of the need. Please note, Sedera does not dictate what type of care is necessary. Members can make their own healthcare decisions. It is just asked that the member have a consultation and receive a second opinion. Lastly, but definitely not least, Sedera's team of member advisors are here to help members with a long list of things regarding their healthcare, some of which we've already talked about. Think of them as medical cost-sharing coaches who support members in their transition to addressing their healthcare costs in a new way and assist them in their journey to becoming savvy healthcare consumers. Sedera is committed to their members and have never had an eligible need that was not fully shared. The Sedera community is growing year over year. On average, needs are funded in 14 days, and since the community is a nonprofit, members have additional assurances that Sedera's focus is on their members and not profit. Okay, let me talk now about the eBenefits side of the program. If you recall, when you sign up, you first choose an eBenefits plan that best fits you and your family, and then add your Sedera membership. The eBenefit plans focus on your preventive care, and there are two options to choose from. The first option is the eBenefits HDHP Essential Plan. This option provides 100% coverage for all your preventive care needs. It also includes a VPC solution that provides virtual primary care with a $0 copay and unlimited use. Through the VPC, members can seek care for a number of health issues, including those shown here. Perhaps 30% of those enrolled choose this option, but interest is growing with the recent addition of the VPC service. The eBenefits Essential Plan also qualifies to be paired with a health savings account. An HSA, as you may know, is a great way to put aside tax-free dollars to use towards any future qualified medical expenses, such as doctor visits or prescriptions. Shown here are the 2022 contribution limits. The second option for folks is the eBenefits Summit Plan. The Summit Plan also includes the same 100% coverage for all your preventive care needs, but then adds a copay framework for ongoing care. The VPC solution is also available with the same $0 copay and unlimited use. The Summit Plan adds a prescription drug program and other benefits. Here's some more detail on the copay framework for the Summit Plan. As you can see, a visit to your primary care is $20 and specialists would be $50, as would any lab work. The Summit Plan also includes prescription drug coverage, as I've mentioned earlier. You have tiers 1 and 2 for generics, tier 3 for preferred brand names, and so on. As a reminder, any curative type medicines will be shared through your Sedera membership, so this plan is really for your maintenance type medications. When we discussed Sedera earlier, we mentioned that there's no network restrictions. However, with eBenefit plans, you must utilize a provider in the multi-plan PHCS network. Shown here is an example search offering a robust choice of primary care physicians. This search was conducted by zip code for a rural county about 45 minutes outside Washington, D.C. You can run your own directory searches and instructions are provided on the website. So let's talk about pricing and start with the eBenefits plans. On the left is member only, member and spouse, member and just the kids, or member and the entire family, spouse and children. The second column is the Essential HDHD plan that offers just preventive care, but does allow you to set up an HSA and use the VPC service. The third column is the pricing for the Summit plan, which includes prescriptions, copays for ongoing care, and the VPC service. The red arrow highlights the monthly cost to our member with the RA condition we discussed earlier. Sedera pricing is more structured. You'll see the same enrollment types along the left, member only, member and spouse, member and children, and family, but it is further broken down by IUA level selected and banded by the member's age group. Again, the red arrow indicates the Sedera membership are member with RA selected. Here you can see his total monthly cost is $308.62, and this includes the eBenefits Summit Plan and a Sedera membership at the $1,500 IUA. When you visit your local chamber or association's webpage for the program, you can find current pricing and important reference documents such as the Sedera member guidelines, FAQs, and link to the multi-plan PHCS search tool I mentioned before. To summarize, the program is currently available in 45 states and does not require an employer sponsor. Individuals are free to enroll directly. For companies, the program has no enrollment limits and is available to full-time, part-time, seasonal, hourly, and salaried staff. The monthly cost can be paid by the employer or the employee, and it provides a great employee benefit at no expense to the employer. As I mentioned at the beginning, participants are seeing an average monthly savings of around 50%, and a dental care add-on plan is available. Thank you very much for your time. Please feel free to reach out to our Help Center by using hpsupport@smallassociations.org, and we'd be delighted to assist you in any way that we can. Thank you for joining us.